Hello, everyone. Hello. Hi. Welcome, welcome, welcome. Welcome, 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 welcome. I'm just waiting till I see some people coming in. If you can see me, just tell me you can see me. And we can get started. Hi, everyone. How are you doing? Hello. Hi. Hi, everyone. How are you doing? Let me see the comments. Hi. Oh, hi from Brazil. How are you doing? Good evening, Ebony. How are you? Okay, great. Hi, Charla Williams. How are you doing? Hello, Cecilia. Mary, how are you? Anika? Anik, how are you? Greetings. How are you? Sandra, how are you? Good evening. Good evening, everyone. Good evening, all of you. Hi, Wanda. Hello, Annette. Hi. Hi, Dr. Annette Stokes. How are you doing? How is everyone doing? Hello. Okay, hi. Well, welcome to Q&A with Dr. Mercy. I'm sorry about the highlight of my shadow. I'm sorry about that. But welcome to another session of Q&A with Dr. Mercy. Today what we're going to talk about is we're going to talk about what's in a snore. A lot of times when I'm in the hospital, I see a lot of patients who have this condition called obstructive sleep apnea. And a lot of times I ask them, are they on their treatment for the sleep apnea? And they say, no, not really. So when I hear that, it reminds me that perhaps they don't know a lot about what sleep apnea is. And I decided that I would use this opportunity this week to go over sleep apnea and kind of have a break from the COVID. So if you have any questions about snoring, sleep apnea, feel free to ask me and we'll just dive right in. Okay. So I have actually done a presentation about sleep apnea and I'm about to, let me go ahead just a second here. My computer is acting up for some reason. I'm going to add it to our stream. And just one second. And so, what is in a snore? So, the truth about sleep apnea. So, before we get to what is in a snore, what is sleep apnea? Let's talk about what is in a snore. So, all of us have snored in our lifetime. Some of us more than others, but not all snores is a bad snore. Meaning, not all snores is a condition or a disease in which you are having some problems with. There are some snores that are happening as a result of you taking things such as alcohol, or when you smoke, you have increased risk of snoring. And when you have underlying conditions such as when you have enlarged tonsils, that can cause you to snore. When you have a deviated septum, meaning a deviation in your nose, or a congested nose, that can cause you to snore. Being overweight can cause you to snore. Asthma, allergies, having a lack of sleep, as you all know, can cause you to snore. Lastly, sleeping on your back can also cause you to snore. So not all snore is snore due to sleep apnea. Sleep apnea does not cause all snore, and all snore is not due to sleep apnea. So I wanted to bring that out first so that everyone's aware that just because you snore doesn't necessarily mean you have obstructive sleep apnea. But if you snore a lot, that's when you need to figure out why you have the snore. And here are the different conditions of why someone would snore. Okay, let me go to the next. So, what is obstructive sleep apnea? Why should we care about it? Well, obstructive sleep apnea is really when someone is sleeping and they snore. You hear them visibly snoring. And behind the scenes, what's happening is in the back of their throat, their muscles of their throat relaxes, causes their throat to back into the airway in which they're receiving and expelling air. So when you take a deep breath, what you're doing is you're taking a deep breath into your windpipe, right? Into the lungs, right? You're taking air in from your windpipe down to your lungs. And when you exhale, you take air out from your lungs, out of your windpipe, and out of your body. Well, with sleep apnea, when your muscles surrounding your tongue is relaxed, it causes your tongue to go and block that airway. And so when they're taking a deep breath in, you hear the snoring sound. That is them trying to take deep breath in while their tongue is in the way of that windpipe, okay? So I hope my computer. So this is the way when someone is laying flat, this is how your body looks. So you see over here, I hope you're seeing my mouse. You see the tongue. You see here when I was talking about the airway and the windpipe, this is what I was referring to. This area here, and this area here goes eventually to your lungs. So it's this area goes into your lungs, right? So it's supposed to stay open. That's the whole point. When you take a deep breath in, you're supposed to have an open airway so the air can go into your lungs. And when you take a deep breath out, the air goes out of your lungs into either your mouth or through your nose. What happens, like I said, is the muscle surrounding the tongue relaxes when you go to sleep. And depending on the person, if it relaxed too much, like I said, the tongue goes down and obstructs, meaning blocks that airway, your windpipe. So as you're taking a deep breath in, you're hearing that noise, and that noise is more so the tongue obstructing your airway, okay? So what does that do with your sleeping? Well, if the tongue is obstructing your airway like that, there's periods of time when you're sleeping where you're not getting a breath. And if someone is looking at you, if you have obstructive sleep apnea and you're not getting a breath, you would look like you're not breathing. So for those who have obstructive sleep apnea, they'll have times where they're breathing, and then all of a sudden they stop breathing. And then they take a huge deep breath because the brain recognizes, oh, I'm not getting oxygen, I need to take a deep breath. And then they take a deep breath and they breathe, and stop. And then they take a deep breath, breathe, and stop. It's almost like a cycle thing. And I've seen that a lot of times in the hospital. I will be hearing this loud noise coming from a patient's room. They're busy snoring, and all of a sudden I don't hear noise. And I go into their room and I see that they stop breathing. And then I wait a couple seconds and then they're breathing again. And then the snoring continues. It's just this cycle. So they either snore, they either have that gasp that I told you, they can choke or snort. And so these are the characteristics as someone who has sleep apnea you would be experiencing. And if your partner or someone who's on the same bed with you, this is what they would experience when someone has sleep apnea. This is what they would see. They would see that their partner is not sleeping well in terms of they're not taking good deep breaths in all the time. They'll have periods where they stop breathing, or they'll be choking or snorting or gasping. So what does that do with your sleep? Well, if you're having those periods of time when you're sleeping and then you're not sleeping, and then sleeping and then when you're breathing and you're not breathing, and you're breathing and you're not breathing, it's going to interrupt your sleep pattern, and you're not going to have recuperative sleep. So when you finally wake up, instead of feeling refreshed, you oftentimes will have some daytime sleepiness. You may have some morning headaches. You may have some difficulties concentrating. And then it may lead to some behavioral problems because you had that lack of sleep. You were not able to restore yourself, restore energy, because your sleep was disrupted due to these cycles of breathing and not breathing, or breathing well and not breathing well. So you may feel some frustration, anger, even depression. And so I want to hone on that, because a lot of times when people feel depressed, or they're sleepy a lot, or having difficulty concentrating, You also should realize that it may not just be just solely due to you just being depressed, but there may be an underlying condition like sleep apnea that could be causing your issues. So that's why when you feel depressed like that, or you feel difficulty concentrating, irritability, you want to seek the help of your physician to make sure it's not something, a medical condition that is leading you to these emotions. Okay. Okay, I'm going the opposite way. Sorry. So let's say you say, "Oh, I got those symptoms. I definitely have these symptoms that you're telling me about. What should I do?" Well, first of all, you would want to talk to your doctor, right? You would want to make sure that your doctor uh, will assess you and see whether or not you do have the condition that is suggestive of obstructive sleep apnea or sleep apnea. If your doctor is concerned that you may have the condition, what they'll do is they'll order a sleep study test. This sleep study test can either be done at home or it can be done in the sleep lab. And that's usually a clinic or setting, or even within a hospital setting. What they would do is they'd have you book an appointment. If they want you to do it in the sleep lab, what they'll do is have you book an appointment for you to be seen. You would sleep in the sleep lab for a period of time. They will have you connected where they'll be monitoring your oxygen levels. They'll monitor your brain waves. They'll even monitor your heart rhythms as you sleep. And they will be noticing how many times throughout your sleep you stop breathing. And depending on the amount of times you stop breathing and other assessments, they'll be able to confirm whether in fact you do have sleep apnea. And so let's say you do have sleep apnea. What are some of the treatments? Well, one of the treatments is called what we call a CPAP. And what that is, as this gentleman has on his face, is a machine that you put in your nose. You put on your nose. Sometimes people put it on their nose and mouth, but primarily it's on their nose. And that machine, what it does is it pumps air into your nose through your mouth so that pressure of pumping air can lift that obstruction that's happening in your windpipe so you can have air down your lungs, okay? So it helps to open up that area of constriction in your windpipe so you can have a flow of air go through it. And so that's the machine that people usually use at night. Now, I want to say a couple things about this machine. A lot of times, this machine can be uncomfortable, okay? And I know some patients have talked about it not feeling right and not wanting to use it at all. And there have been patients that I've had in the hospital that said, "Yeah, I used it a year ago, but I stopped using it." And I would want to always tell them, no, that's not the way to go, because the whole goal with sleep apnea is you want to treat this apnea, because not only, as I will explain later, does it affect you when you wake up in the morning, you're not feeling refreshed, but over time, it can affect the rest of your body. And I will explain that later. So what I want to say now is, if you do feel like your machine is not well fitted, or you're just uncomfortable when you're wearing it, go back to your doctor and let them know. They have machines, different types of machines on the market, different types of treatment that you could be able to do that will help you in case you can't tolerate the machine, okay? It's important that you do get the sleep apnea under control. It may appear that, all I just do is feel groggy. I can get over it. Yeah, I sleep during the day, but no, it's more to it than that. It affects your body a lot more. So it's definitely important that you adhere to treatment for your sleep apnea. So again, this is the CPAP machine, just from a view where you can actually see inside the body how it works. And as I was telling you, right, the machine is attached to your nose, right? And then it pumps in air, right? Pumps in air through your nose, down your throat, and that area that was closed, as the pressure of the air pumping through, what it does is it kind of pushes the tongue out of the way. So now you can get oxygen to flow into your windpipe and into your lungs. So it helps to move that tongue and that or any surrounding tissue so that the airflow can go through and down your lungs. So it's very helpful, and it's definitely something we use both in the hospital and with patients who have sleep apnea at home. So like I said, if you can't tolerate the machine, just use something. And one alternative therapy that they have in store for people who can't tolerate the machine is using alternative devices like teeth devices. What that does, some of these teeth devices that they have out there, what it does is it helps align the teeth so that it can also help with that obstruction. So when you are aligning the teeth with this device, what it's doing is it's, again, helping relieve the obstruction so that now when you have that device in place and it's moving the tissue from your windpipe so that your oxygen can flow through. So again, it's just important that you do have treatment for obstructive sleep apnea. Even though you can't tolerate the machine, there's other therapies out there that you can use that can help you. So the question is, why should you be concerned with sleep apnea? So what is it? Why am I harking about sleep apnea? Well, this is what I was trying to say earlier. Sleep apnea, over time, studies have shown that sleep apnea contributes, if not helps to cause other conditions in your body. So not only does it cause the sleepiness, the fatigue, the depression, you being irritable, but did you know that some of these motor vehicle crashes is due to people who are sleepy at the wheel because of the fact that they didn't get enough recuperative sleep? So it can cause danger, and it can also cause even occupational accidents outside of that. So sleep apnea and you not getting recuperative sleep can affect what you do during the day. But not only that, internally in your own body, from your heart, it's associated with underlying heart disease. So it can either exacerbate your underlying heart disease or have you have a high risk factor for having heart disease. It can cause you to have abnormal heart rhythms. Okay, those who had sleep apnea, they were shown to have other abnormal heart rhythms like atrial fibrillation. That's an example of one. It can cause you to have an increased risk factor for diabetes, for sexual dysfunction. If you have underlying asthma, it can exacerbate your asthma or any underlying lung issue like pulmonary hypertension. Okay, if you have acid reflux disease, it can worsen that. If you're pregnant, it can cause hypertension when you're in pregnancy, or it can exacerbate diabetes in a pregnant woman. So there is more to sleep apnea than people know about. And this is where I wanted to focus on. And this was the reason why I wanted to talk about it. Because a lot of times I see patients who have sleep apnea, but they're not using their machine. And then they come to the hospital and they have uncontrolled high blood pressure. And I try to explain to them that, did you know that your uncontrolled high blood pressure could be because your sleep apnea is not under control? Perhaps if we control your high blood pressure, perhaps if we control your sleep apnea, then your high blood pressure would be under control. Or people who have uncontrolled diabetes, or people who have underlying heart disease. You always want to treat the sleep apnea, because a lot of times when you treat that sleep apnea, it helps with any other condition that you may have in your body. So a lot of times when whenever a heart doctor comes to see my patients, if they have sleep apnea, one of the things that they always recommend, and they tell me behind the scenes, is make sure you get that sleep apnea under control. If they have not seen someone to get a machine, make sure that they have an appointment to see someone to get that machine, or have someone confirm that they do have sleep apnea by getting that sleep test. And if they're not using their machine, make sure we stress the importance of them using their machine. So it's really, really important. Anybody in this program, if you have sleep apnea and you're not using your machine, or it's been years since you used it and you don't even know your settings of your machine anymore, it's really important for you to get back on that machine. If that means go back to your primary care doctor, get a referral to get a sleep test done, go ahead and do it. If you're snoring, but you notice that during the day you're not having really good recuperative sleep, or your wife is telling you, or your husband is telling you that you snore so loud that they can't be in the same room with you, it's a good idea to get checked. It's a very good idea to get checked, because you may think, oh, it's okay. No, over time, that issue can affect your body adversely, and you don't want that. So how can we prevent sleep apnea before we get it? Well, or how can we prevent snoring in general? Well, sleep apnea has been associated with obese patients. So a lot of people who have sleep apnea, what I like to tell them is that one way to improve your sleep apnea is by losing weight. And losing weight is usually the answer to a lot of conditions, from hypertension to diabetes, and now sleep apnea. So if you do have sleep apnea and you're like, how do I hate this machine, I want to get off of it, and you're obese, try losing the weight, and that can help. They have other alternatives. They have other alternative therapies like surgeries that can help with also sleep apnea. And I would just suggest you talk to your doctor about what therapies is right for you. Other ways to stop snoring, just in general, is just smoking. If you stop smoking, if you avoid alcohol consumption before sleep, and if you make sure to get a recuperative sleep, meaning if you make sure that you don't take sleep for granted. And so if you are only on 3 hours or 4 hours of sleep, try extending that longer periods of time so that you won't snore. And so these are just tips on how to prevent yourself from snoring. And the ultimate tip for someone who already has sleep apnea to improve your condition is by you losing weight. So with that, I think that is it for my presentation. I want to know, are there any questions or any comments? So let's go to the comment section. I see a lot. I'm just going to scroll through. Oh, good. So Natasha Sanders says, I got the dental device 2 weeks ago. I like it so far. I hope it's effective. And for some people, it is effective. So yes, this is a good alternative as well. Thank you. Andrea Jacobs, I use my machine. Awesome, great. So it's helping you not only getting your recuperative sleep, but it's also helping your body. And any underlying conditions you have, it's helping to control that. So I'm glad that you're getting that. I'm glad that you're doing that. It says the CPAP must be really romantic for a married couple. There has got to be another treatment. Jesus, I wish it was. I wish there was another machine that could be used. Of course, it is in the works, new therapies, and if there's something that is more romantic, I'll definitely let you know, Charlotte. Thank you for that. So Herbert had asked, why do I experience severe headaches with sleep apnea? What is happening to the brain that is causing these headaches? Great question, Herbert. One of the things that comes to mind when you have sleep apnea and you have the headaches is you're not getting enough oxygen to your brain. A lot of times when you have headaches like that, it's it's your body or your brain telling you, I'm not getting enough oxygen. So that's the importance of the CPAP machine or the breathing machine. It will pump in air into your lungs and give you that oxygen. And you should notice a decrease of the severe headaches. Now, if you have severe headaches with the sleep apnea, with the sleep machine, then what you need to do is go to your doctor and ask for another sleep study, because your machine may not be properly adjusted for you. But if you're just getting headaches without the machine, it's because your brain is not getting enough oxygen to the tissues, and that's why. So let's go with other questions. Thank you so much, Sherry. I appreciate it. Thank you so much. Thank you so much, Johnny. I appreciate it. So Charlotte, why I have headaches? Whoa. Okay. Yeah. I mean, headaches can be numerous number of things, and we can have a live on headaches because there's just so many things that can cause it. But if you notice headaches, daytime sleepiness, then you may, and somebody's telling you that you're snoring, yeah, you may want to get a sleep study, because headaches could just be due to that. But headaches could also be due to high blood pressure. Have you checked your blood pressure today? You can get headaches from that. So, or it could be due to high or low sugars, blood sugars, especially if you have diabetes, if you have low sugars, it can be due to that. So you just want to make sure, okay, besides the headache, what else am I getting the headaches as a result of? Headaches can also be due to dehydration. Are you drinking enough fluids? It could be due to that. So there's a lot of things that can cause headaches. But if you're noticing that you're not getting enough good sleep, you're snoring a lot, and you're daytime sleepy, and you have the headaches, then it's likely sleep apnea, and you should see somebody about that. Oh, okay, Tisha. Hello, you sound just like my doctor. She told me if I lose the weight, the sleep apnea, pre-diabetes, pre-hypertension will subside, along with my non-alcoholic fatty liver. Exactly. It sounds like you have a very good doctor, and you should keep her, or him or her, whoever. Oh, it's her. You should keep her, because losing weight is the bottom line. I tell my patients that all the time. You want a medication that's free, a therapy that's free, lose the weight. I've seen numerous times people who lose weight either through surgical or non-surgical means. They're off of their diabetes medication. They're off of their high blood pressure medication. I mean, and the fatty liver improves. So, it sounds like your doctor is speaking my language, and you should keep her. Thank you for telling us, Tisha. So, Linda, I have the Philips Dream Machine, and I saw a report recently that it's causing problems. What do you recommend, or can it still be used? So, for specific machines, I cannot really attest to. I would just say go to your doctor, especially I don't know if it was a pulmonologist, a lung doctor who had prescribed that to you. I would suggest talking to them in particular and see what exactly that they would suggest, whether or not you need to change the machine or you can continue to use it. Sometimes, some of these adverse effects may be a few people that experience it, so it's not enough for you to actually stop using it. It's just for you to be aware of it. Whereas sometimes these adverse effects are enough for you to stop it. So what I would do is I would suggest you talk to your doctor, and they can tell you more about what your next step would be. Okay. I have asthma and I'm allergic to smoke and to everything like insects. Okay. Well, if you have asthma, just be very careful. You have a risk factor of possibly having sleep apnea. So if you're noticing snoring along with that, definitely get tested. But yes, if you are allergic to smoke and to other things, consider everything like insects. Consider also seeing a allergist. if you're allergic to multiple things. Because what an allergist can do is they can do an allergy test, right, to give you a certain information on what particularly you're allergic to that you can avoid. And then they may prescribe certain medications to calm down your immune system. So even if you're exposed to it, it's not that bad. Or they may suggest things like allergy shots. And allergy shots, what that does is it gets your body exposed to these allergens that normally would cause a reaction. So you're getting little by little, so your body can desensitize itself, meaning your body won't be reactive the next time you get exposure to certain allergens that normally it would affect you. So if it's really bad and it's affecting your day-to-day, I would suggest you seeing an allergist who can help you further. So we couple more questions and then we will call it a day. Herbert, I know I don't use the machine because I totally hate all the wires and lines. I just can't. So that's where I would suggest you using some of the like alternative therapy, like the dental device, or you even maybe depending on the severity of your sleep apnea, there are surgeries out there that can also help to treat it as well. But I definitely don't recommend you not treating your sleep apnea. Try losing weight in the meantime if you need to. If you are not in your optimal weight goal for you, and that is within your height and weight, there's a certain weight goal that you need to be. That's called your BMI. If you are over 25 on your BMI, then that means that you're overweight. And so the number one thing I would do if I were you, if you're above that 25 for your BMI, is to lose the weight so you can be below 25. And perhaps that'll improve your sleep apnea to the point where there may be a possibility that you don't need to use a machine again, or it's a very mild source of sleep apnea that you can just use a dental device for. So that would be what I would suggest for you. Okay. And with this, I will end it with this. Great information. I had no idea smoking would have anything to do with snoring, but it makes sense. I've never snored until I started smoking, which is in my early 40s. See? Yes, it definitely does. So if this is one way to help you quit, I hope this is a good public service announcement. Because smoking is not only just obstructive sleep apnea. It's tied to cardiac disease. It's tied to strokes. And especially if you have a family history of that, you don't want that. And of course, we all know it's tied to cancer, like colon cancer, lung cancer in particular. So, if you can quit smoking now, that would just be better for you. Because you don't want, trust me, you don't want to go down the road of a smoker's life. You don't want the COPD, which is a lung disease. You're hacking and coughing, or you're getting to a point where you require oxygen and you can't breathe. It's just not worth it. So if you can try other alternatives for that sensation, if you have to, you can have your doctor prescribe you a nicotine patch or a gum or something to help you to quit. But my recommendations would be, if you could, while you can, just not smoke. So anyways, that's all the time we have today. What's in a snore? The truth about obstructive sleep apnea. If you got in this our conversation that the whole goal is that if you snore and snore and snore, and you're noticing that when you wake, you are alert, you're not as alert during the day, and you're sleeping, especially on the wheel, and you're not getting recuperative sleep, please tell your doctor, because the more you have uncontrolled sleep apnea, the worse it is for your body, and you don't want that. And so if that's what you got from it, that's awesome. So anyways, we end this session of Q&A with Dr. Mercy. Next week is going to be Medicine for the People with Dr. Susan. Make sure, if you guys have not subscribed, make sure to subscribe to Black Women Empowerment, where you'll get tips and other speakers who will speak to you about life and speak to you about God and your relationship with God and or about mental health. And so make sure you tune in. We also have our BWE network where you can subscribe to as well. So until next time, I want you guys to have a wonderful, wonderful weekend and have an awesome next week. Okay, bye.